In this video, we are going to see about the deltoid muscle. It is a powerful muscle. You can clearly identify the rounded contour of shoulder over here. The deltoid muscle is responsible for this because the muscle overlaps the upper end of humerus. First, we will try to identify the bones that are depicted in this view. This is for the first one over here is the anterior view. This will be the posterior view of the bones, proximal bones of the upper limb. This is the lateral part of the clavicle. Further laterally, we have the acromion process of the scapula. From the posterior aspect, we can identify the spine of the scapula over here, and we can clearly see the acromion process is continuous with the spine of scapula. Other bony parts that are clearly visible in this view are, we can identify the head of the humerus, greater tubercle, the lesser tubercle, bicipital groove, and this is the view of the deltoid tuberosity from the front. In the second diagram, here this will be the area of deltoid tuberosity from behind. Now, we will specifically look into the origin of the deltoid muscle, mainly from three areas, three bony parts. The first one, the anterior border of the flattened lateral 1/3 of the clavicle, that is this particular area. Second, the lateral border of the acromion process. Over here, we can identify the lateral border from the front. Also, here also we can identify the lateral border of the acromion process. And thirdly, from the whole length of lower lip of the crest of spine of the scapula. To see that, we have to look from the behind, posterior aspect. This is the area of attachment of deltoid in the spine of scapula. These three are the origins of deltoid muscle. When you look at the insertion, all fibers of the deltoid converge for insertion to the deltoid tuberosity around the middle of the shaft of humerus. This deltoid tuberosity is a V-shaped impression that involves the lateral surface of the shaft of humerus, and as we said already, it is extending up to the middle of the bone. Since the muscle is taking its origin from three sources or three bony parts, we can divide the muscle fibers of deltoid into the anterior group of muscle fibers, the posterior group of muscle fibers, and the lateral group of muscle fibers. Anterior fibers are arising from generally the clavicle, posterior fibers are arising from the spine of scapula, and the lateral group of fibers are arising from the lateral surface of the acromion process. When we look specifically into the anterior and posterior fibers, we can clearly see they are long and arranged in parallel bundles. We can see the parallel bundles of muscle fibers over here. We can also use the term unipennate to see this, to explain this arrangement. When we look into the acromial fibers or the lateral fibers, we can identify they are multipennate in arrangement. We will see some more specific details regarding this multipennate fibers. We can identify the acromion over here. This is the lateral border of the acromion, and it presents four tubercles. Each of these tubercles gives rise to four fibrous septa. This is first, second, third, and fourth fibrous septa, which is descending into the substance of the muscle. Similarly, from the inferior aspect, this is the deltoid tuberosity, which is shown schematically. From the deltoid tuberosity also, the fibrous septae ascend into the space between the previous four septae. The adjacent surfaces between these septae provide origins of series of multipennate muscle fibers. You can see the arrangement of multipennate muscle fibers clearly here. This arrangement of multipennate fibers diminishes the range of contraction, but effectively they increases the force of pull. When we look into the nerve supply of deltoid muscle, we can identify it is supplied by the axillary nerve that is arising from the posterior cord of brachial plexus. The actions, we can identify individual actions for each of these fibers. The acromial fibers, they act as prime mover of abduction of shoulder joint, which is anti-gravity action, and the anterior and posterior fibers act as guy ropes to steady the abducted arm. The clavicular fibers specifically, together with the pectoralis major, produce flexion, adduction, and medial rotation of the shoulder joint. The posterior fibers, they assist in extension, adduction, and lateral rotation of the arm. For completion's sake, we need to identify a specific topic under the deltoid, that is structures under cover of deltoid muscle. We will have bones, then muscles, bones and joints, then vessels, nerves, ligaments, and bursae deep to the deltoid muscle. We will identify the bony parts in this particular image. We have already identified the different bony parts. I will just summarize over here. This is the coracoid process. This is the greater tubercle of humerus, lesser tubercle of humerus, intertubercular sulcus. Then on the upper part, we can identify the head of the humerus. Here we have anatomical neck of the humerus. Here we have the surgical neck of the humerus. All these parts, mainly the coracoid process, lesser and greater tubercles, intertubercular sulcus, upper part of shaft, and surgical neck of humerus, they lie under cover of the deltoid muscle. Next, we will focus on the other structures. The muscles that are under cover of deltoid include the pectoralis minor, which has been cut and reflected over here. This is the pectoralis minor tendon. Then coracobrachialis and heads of biceps brachii, both heads of biceps brachii. Coracobrachialis and short head of biceps brachii we can identify over here, and the long head is coming from the intracapsular region. Both are under cover of deltoid. Then we have the pectoralis major, latissimus dorsi, and teres major, and these muscles are present in relation with the intertubercular sulcus. We can identify the latissimus dorsi fibers over here. These are the teres major fibers. This is the lateral lip of the intertubercular sulcus where we have the insertion of pectoralis major. All these three muscles also lie under cover of deltoid. Then this large muscle in this subscapular fossa is the subscapularis, which is getting inserted onto the lesser tubercle of humerus, that is also lying under cover of deltoid. Then we have some muscles of the other muscles. Subscapularis is one of them, the rotator cuff muscles. The supraspinatus, we can identify the muscle over here. Then posteriorly, we have the infraspinatus and teres minor. They also lie in a deeper plane to the deltoid. Finally, on the posterior aspect, the long head of triceps that is arising from the infraglenoid tubercle that also lie under cover of deltoid muscle. When we look into the neurovascular structures, that is the vessels and nerves over this area, we can identify the anterior circumflex humeral vessels over here and the posterior circumflex humeral vessels over there. The anterior circumflex humeral and posterior circumflex humeral are branches of third part of the axillary artery. Along with the posterior circumflex humeral artery or humeral vessels, we have a nerve. This particular nerve, and this nerve is the axillary nerve. That is, these structures, these are some of the important neurovascular structures lie under cover of deltoid muscle. Then we look into the joints and ligaments lie under cover of deltoid muscle, mainly obviously the shoulder joint and its ligaments, and also the coracoacromial ligament also lie under cover of deltoid muscle. This is the coracoacromial ligament. Then we have to see the bursa undercover of deltoid. We can identify the important bursa over here, that is located over this area. That bursa is the subacromial bursa intervening between coracoacromial arch and the supraspinatus muscle. And the same bursa may extend as subdeltoid bursa between the deltoid and greater tubercle of humerus, which is clearly identifiable in this diagram over here. So these are some points regarding one of the important muscle of shoulder region, that is the deltoid muscle. Thank you for your patient listening.